Once we find out if the patient has sepsis in the emergency room, what is treatment?
So first and foremost, and we'll talk about it in a little more detail, is that first dose of antibiotics and to continue antibiotics. What we try to do, if we have an idea where the source of the infection is, we'll pick antibiotics that target that area. If it's pneumonia, ones that are good for the lung. If it's the urinary tract, antibiotics that are good for that. Often though, if the patient's very sick, we will give 2 or 3 antibiotics in the very front end until the situation declares itself a little bit more, and then we can try to target the antibiotics more specifically.
So you're going to cover gram-negative, gram-positive, just about everything initially, and then when you really know what it is, you back away from some and keep the big baby going.
Right, right. That's exactly right.
Okay, so you've got antibiotics, very important. Start them quickly, quick as can be.
Right.
And then what else other than antibiotics?
So some infections are actually, they wall themselves off. That can be called an abscess, for example, and antibiotics don't get into those areas. So for example, a regular pneumonia with sepsis, antibiotics do pretty well, but if the infection has walled itself off, sometimes we have to do procedures to put a drain into that area so that we can drain that infection out.
So it would be like a boil on the skin, not with sepsis, but a boil, you'd have to incise it and let it drain maybe.
Right.
So you may have to do that in the urinary tract or in the lungs or in the skin or in the GI tract.
Absolutely, yeah.
Wow.
Right.
So we relieve the site of the bacteria, and so now we've got antibiotics, we've opened up things, we know where we are. What else is important?
So some other things that we do routinely, depending on the specific needs of the patient, intravenous fluids is very common.
Why is intravenous fluids important in sepsis? What's happening in the body that you need fluids?
So part of that is that we want to maintain the blood flow and the oxygen flow to the vital organs. And so particularly if there's issues with blood pressure, that fluid can help maintain the blood pressure and maintain the flow. Now, if we've given what we feel to be enough fluid and we're still having problems with blood pressure, we have other medications. They're IV drips that can actually support the blood pressure, raise the blood pressure, again, to try to make sure those vital organs are getting what they need.
So do you monitor the vital organs, the urinary tract, the urine outflow, the amount of oxygen that's getting from what we're breathing into the body? Do you monitor that at all times?
Absolutely. The more severe the sepsis, the more different things that get closely monitored. Generally speaking, more severe sepsis is going to be admitted to an intensive care unit, and on a minute-to-minute, hour-to-hour basis, we're looking at heart rate, blood pressure, oxygen saturation, and urine output.